Good afternoon, everyone. And first, let me take the opportunity to thank Minister Lake for inviting us here and participating in today's wonderful announcement that we firmly believe will have a positive impact on the lives of many British Columbians across the province. The Minister has always had a very open-door policy. I've been working with him now for the better part of 4 years. And his open-door policy has meant that he's listened to not only the concerns of our membership, but also to the over 25,000 seniors that we care for each and every day. And given that he's going to be stepping back from public life, I think you were counting down the days earlier. I don't know how many days it is, but in a few weeks, he will be stepping down from public life. So please allow me to acknowledge the amazing contributions, Minister, that you've made over the last 4 years. In those contributions, helping people have a healthier life and be able to improve their life in British Columbia. So thank you very much for your 4 years. I'd also like to take an opportunity to thank Dr. Plekas, whose report forms the basis of our announcement here today of new funding. And Dr. Plekas definitely has toured the province and has been to many care homes. I've had the opportunity to tour with him on many occasions myself. He has taken a significant and profound interest in the area of seniors care, and we as a sector and the seniors of this province owe you a debt of gratitude for your interest. So thank you very much, Dr. Plekas. No doubt we'll look back at what I'm now pleased to say is the Plekas Plan or the Plekas Report. There's a lot of Plekas going on, but we'll call it the Plekas Plan. And we're going to look back and say that this was a very pivotal moment for us in terms of being able to deal with the growing needs of our rapidly aging population. I also want to acknowledge Isabel McKenzie as well, our seniors advocate, for all the work and tireless efforts she's put in to make sure that we raise awareness about the important need to strengthen our home and community care system in the province. So thank you very much, Isabel. Ladies and gentlemen, today is truly an amazing day. The new investments the Minister announced, as I alluded to earlier, will have a profound impact on the lives of countless seniors across British Columbia. Back in January, after over a year of consultation and research, the BC Care Providers Association released a paper with 30 key recommendations to strengthen seniors' care. I'm very pleased to say that with over $500 million in new funding made available today, in part due to the National Health Accord that was recently signed with the federal government, we now have a focus on quality, training, renewing our infrastructure, and many of the recommendations that we made earlier this year will be addressed thanks to the action plan that was released today. So thanks again to the Government of British Columbia. We are celebrating our 40th anniversary this year at the BC Care Providers, and over the last 4 decades, we've witnessed a significant amount of changes that cover everything from how we deliver care to the demographic makeup of who's receiving it. And it may not come as a surprise to those of you who are here that work in the sector, but the average age of seniors now coming into residential care is about 88 years old. Very different than a number of decades ago. But that's a good news story, because what it means is that many of those seniors are now living at home longer, and they're able to stay at home longer because there's been efforts to put in supports in the community for them to stay there. Today's announcement goes a long way to helping to increase the number of clinical staff at the bedside. It helps move the needle when it comes to getting our workforce ready to take on a career in the growing and exciting field of seniors care. I think it's great, it's exciting. I want more people to work in seniors care, so today's announcement is fantastic. Today's new funding will have an impact on reducing worker injuries and make sure that new and existing care homes and home care providers are better able to manage the complex needs of our residents. And lastly, the new funding will also address the needs of something we call the sandwich generation. They are people who are taking care of both their elderly parents and also managing their children as well. And the numbers, I hadn't appreciated the number of additional care hours that are being provided until Isabel mentioned it, but those additional care hours will go not only to help the seniors, but also their families as well. So that's very important to note. So whether you live in Nelson, Kamloops, Prince Rupert, or New Westminster, you want to know that the care will be there when you need it. In fact, Care Can Be There was the theme of our recent public education campaign, which triggered a significant amount of community response. Minister, Dr. Plekas, on behalf of our members and the over 25,000 seniors that we care for each and every day, I can now confidently say that the care will be there. And we look forward to your continued partnership and to work with the government to help make that happen. Thank you so much.